Thank you so much for having us and for having me back again. So today we're going to really discuss some of the background work that we've done to date on guidance at ICES for responsible data use and analytics of race and ethnicity data. So we'll talk a little bit about some of the work that's been done to date and some of the next steps as we're still kind of going through this journey right now. So before we get into some of the specifics about the work that's currently ongoing, I'm going to hand it over to Susitha to talk a little bit about the background and kind of how all of this came to be. So I'll hand it to her.
Thanks, Laura, and thanks for the welcome, Marcelo. And I guess just for clarification, my role in the guidance document that Laura is going to be talking about, I'll give you the background on. I worked as a special advisor on it for the last little while, so it's been exciting work, and yeah, we're really excited to present to you about it today. So just in terms of some context about why we, a group of us, started thinking about use of race ethnicity data at ICES. This journey started in the latter half of 2020. And as I'm sure many of you are aware, there was an explosion of studies and lots of news coverage early in the pandemic about how COVID-19 was disproportionately affecting racialized communities. Most of this came out of the United States, but there's lots of news coverage also in Canada about racialized temporary migrant agricultural workers and lots of long-term care workers who were disproportionately dying from COVID-19. And being Ontario-centric, I know this from the Ontario perspective, but I'm pretty sure there are pockets of this happening also in BC and probably across the country as well. So basically, these findings and news stories sparked a really widespread interest in better understanding what was happening in these communities and about these studies. And very much related to this, the medical research community simultaneously began a reckoning, I think is probably a good description for it, about how race and ethnicity data are understood in health research. Many health experts, I think, currently say there's still lots of work to do in this area, but it has really become more widely accepted that race is a social construct and that experiences of racism are really central to the poor health experience by racialized people. Another piece of background that's useful, at least for the Ontario context, is that the Ministry of Health in Ontario began collecting race data in relation to COVID-19 positive cases. In relation to ICES, there are a number of data sets held at ICES that contain race and ethnicity data, or these data are actually, there are some data that are actually also used to assign categories based on an algorithm. So basically, with this greater awareness and the gravity of what was going on in relation to the pandemic and the impact that we were seeing, there were many community groups and equity groups and organizations in Ontario that really began calling for anti-racist approaches to the use of race and ethnicity data. And they also emphasized the responsible use of these data and its governance by communities. And some of these calls were directly at it for ICES to address as well. You can move to the second slide or the third slide. Thank you. So before I go on, there may be some terms that I talked about in previous slides that some of you may not be familiar with. So I thought we would share a few definitions before we go on. And if you're looking for a really fantastic glossary in terms of thinking about anti-racist data science and anti-racist data, I really strongly recommend you check out the Ontario Anti-Racism Data Standard, which are all available online. The glossary is really detailed and fantastic. So the definitions that we share here are from there. So the terms race and ethnicity are often used interchangeably. They are distinct social constructs, and measurement and reporting should reflect these differences. So the definition of race is a term used to classify people into groups based on physical traits or phenotypes, such as skin color. Racial categories, as I said, are not based on science or biology, but are on differences that society has created or they're socially constructed. And these differences have significant consequences for people's lives. Racialization is a term described as the process by which people are judged and categorized into races primarily using physical differences. And lastly, ethnicity is a concept referring to a person's ethnic or cultural origins. Ethnic groups have a common identity, heritage, ancestry, or historical past, often with identifiable cultural, linguistic, and/or religious characteristics. Next slide. So just in terms of the current climate, as I said, there are some data holdings at ICES that contain race and ethnicity variables, and in the future, ICES may be receiving more of these data from the Ministry of Health as well as from other organizations. In the last few years, there have been some concerns raised about how immigration data held at ICES have been used, as well as 2 ICES algorithms that assign race and ethnicity. So basically, in response to all this, ICES has been in the process of developing an internal document to guide the use and governance of race and ethnicity data to ensure ethical and appropriate research analytics, which is what we are here today to share with you. So quickly, just in terms of the race and ethnicity data that ICES have, we have started an assessment of the data holdings, and we're trying to understand the data sources that have them, the validity of the measures, as well as the limitations of the data. And here's just a really quick summary of that assessment so far. There are 44 data holdings where there are words related to race and ethnicity have been found, and those words are there on the slide. Terms such as country or place of birth, cultural, culture, etc. The data is most often self-reported, but sometimes observer-reported. So I know there's one data set in which the physician has essentially guessed a person's race or ethnicity. There's also data that is measured at the census area level. I'll just move on to the next slide. So before I hand it off to Laura to give you more detail about the guidance document we've been working on, I just wanted to drive home a few points about why we need this guidance to help us understand better use of race ethnicity data. So first, there's no guidance on the use of race, ethnicity, or immigration data at ICES. And as I mentioned previously, there have been concerns raised about the use of these data and the algorithms that I mentioned also. And I think a really important point is that as health researchers, we have to acknowledge that race ethnicity data has and is currently misused in health research, since it often explicitly or implicitly wrongly suggests that racialized people are genetically and or behaviorally inferior to white people. And importantly, the misuse of these data have been used to further white supremacist ideology and justify the exploitation of Indigenous and racialized people. As I also have mentioned, there have been calls from many groups in Ontario that have asked ICES to take an anti-racist approach to use of these data and have asked that these data be used responsibly. And finally, a key reason and what really motivated me to be involved in this work is the potential impact such a guidance document to have. And this is really that if these data can be used responsibly in research, it could help to address systemic racism, prevent harm, and ultimately reduce racial health inequities. So with that, I'll pass it off to Laura to give you more detail about the guidance document.
Great, thanks so much for that background. So kind of just dive into the actual document itself. And as Susitha mentioned, there's kind of a few reasons why this work came about, and a lot of them were already touched upon. And I just wanted to mention as well, so some of the community groups calling for more guidance in this area. One of the key groups was the Black Health Equity Group, and they released the EGAP framework, which is the Engagement, Governance, Access, and Protection framework that really envisioned Black communities gaining control over their collective data. And it was this specific document that named ICES as an organization really to think more about governance. And we also touched a little bit on the data that ICES has. Again, there's kind of a current assessment underway, trying to understand the data that we do have. And understanding there still is kind of a gap in some of our data. We don't have a great deal of it, but we do want to explore further what it is we have. Often self-reported is considered the gold standard. So just understanding kind of the conditions of where that data is coming from. It's also important to note that the EGAP actually did call for more data collected, although there is some controversy around this. Not everyone feels that more data actually is needed. So it's important to also think about the nuances there of, again, like where is this data coming from, who's collecting it, and how. So again, all this to say, really this background work and thinking kind of culminated in a core group coming together to start to think about how we can draft a document and draft some guidance for our staff and scientists. And kind of all this came about, as mentioned, around 2020. So really kind of where this has landed is we want to create a guide for community-driven research, which is a really important part of all of this that you'll hear me touch upon throughout the presentation, and really kind of driving that anti-racist use of race and ethnicity data. So it's kind of an internal document that we've been working on, really to kind of not only talk a little bit about our larger organizational goals, but provide kind of more granular guidance to scientists and researchers. And again, with the ultimate goal here and the hope that we can start to address some systemic racism in our work and really think more about promoting health equity. So again, there's a couple key elements that I wanted to highlight that have really been core to all of this as we go about building this document. And again, you'll kind of hear me touch on all of these things throughout the presentation. So learning is a big one, learning and unlearning, and doing a lot of reflection as well. So as Susitha mentioned, thinking about race as a social construct has not always been the case in kind of scientific and medical research and background. So again, doing some unlearning in that area and doing some increased learning and reflection on how we can improve and how we can use this data appropriately and actually to promote health equity. Collaboration has been a huge piece of this as well. So we've wanted to work closely with other community members, other data institutes to understand what work is being done, where are there gaps, and really help us think more about how to structure this work going forward. Kind of in hand with that is also expert advice. So we've consulted with a lot of equity and race experts. We've been consulting with community organizations and actually members of the public, which I'll talk about a little bit later. Really kind of going to these experts for guidance. And then of course, engagement as well. Really seeking to understand what it is from the community that we should be considering to align with their priorities, as well as kind of members of the public and these key organizations and agencies that have been calling for action. So really, in terms of the document development, kind of a little bit of internal details. So really spearheading this group has been a core committee at ICES that has really been put together to kind of think about how this would look, the structure, and kind of some of those more specific details. And again, kind of informing this key core committee is also a larger internal committee of ICES scientists who have worked in this area or have expertise in this area to really kind of also provide further guidance on our directions. And then some work I'll be talking about a little bit later in the presentation is a people's panel, as well as some equity experts. So the people's panel, briefly, before I go into more detail later, was a group of about 54 members of the public that came together in focus groups to really kind of inform some of the recommendations of where we should be taking this work and what guidance we should be considering. So I also wanted to highlight the framework for working with Indigenous data at ICES. So at ICES, we're really fortunate to have kind of a very well developed and collaborative framework within the Indigenous portfolio, which has helped to kind of inform some of our efforts as well. So this framework is already in place and it's kind of well established in collaboration with the Chiefs of Ontario. And because of this kind of well-established work that's already underway, this guidance document that we're currently creating will not kind of go into detail on Indigenous identity and data. And again, that's kind of because we've already developed a distinct approach and policies concerning Indigenous data governance. And again, we work directly with Indigenous partners to ensure that there's actually appropriate use of this data. And specifically with Indigenous data, we actually don't use it unless communities are calling for it themselves. And it's always an engaged and collaborative effort, which again, provided a lot of learning for us going forward as we develop our document. So this diagram really kind of encompasses the key domains of the framework and really kind of what has shaken about through our literature search and our consultations as we've begun this process. So there's kind of 4 key domains here, which I'll touch upon. They're community access, anti-racist research, community governance, and accountability for impact. And then at the center there, you'll see there's principles for appropriate use of race and related data. And these principles really came about from the People's Panel work and really kind of trickled down and to inform some of these larger domains. So then in terms of the overarching goals, kind of the document itself, and then of these core domains, So first and foremost, obviously guiding appropriate use of race and related data is one of our key goals. And then again, kind of in terms of our community awareness, community action, anti-racist research, community data governance, and accountability and transparency. So for the community-driven research, really the goal here is to increase awareness for communities that may represent racialized individuals, really so that they can essentially access and potentially use ICES data analytics to help address health inequities and translate evidence into action. So some of this actually is already underway, but it's really something we're looking to kind of continue to leverage and improve. And that's under our Applied Health Research Question Program, which is essentially, it allows external groups, so primarily health system organizations, to answer a question that may help improve the services they provide. And those analytics are done at ICES in-house and then kind of provided back to groups to help improve care. Furthermore, in terms of the anti-racist research, so again, kind of really thinking about incorporating practices, doing some internal capacity building to think about, what does community-informed and anti-racist research look like and what does that mean? And a lot of this work also is kind of already underway in terms of educational efforts and really kind of ensuring that we're providing adequate support for meaningful community engagement for any projects that may be using race and ethnicity data in their cohort studies. So that's something I'll also come back to. In terms of community governance, so this of course will require a really deeper dive into understanding the best way to do this. And it's something that we want to really ensure is community informed. So kind of in the early stages, an evaluation of existing models will be kind of conducted and underway, and a lot of consultation. We, at this point, want to understand, will this be a collaborative effort with the community governance table that already exists? Will this be independent? What is key stakeholders actually kind of informing us and telling us that would be advisable? So kind of in terms of this domain, it's still very much a consultation process that we need some more thinking around for sure. And then accountability and transparency, kind of throughout this process, we want to make sure that we have mechanisms to monitor kind of our goals, our accountability, and really assessing where we're at in terms of our metrics now and going forward. And again, also thinking about having some of these metrics actually be community informed to ensure that what we're doing is within their priorities. So that was kind of a quick snapshot about where we're at with the guidance document itself. As I mentioned, work is still underway, but I wanted to talk a little bit deeper into some of the work that's been conducted to date and is ongoing to actually inform the development. So as I've mentioned, we've connected with the public and key stakeholders. We did connect with the Ministry of Health. Again, even when we were kind of first started to think about community governance. And we've also connected with other kind of data research groups. So we collaborate with the Health Data Research Network. We also kind of are part of their inclusion, diversity, equity, and accessibility group to also see how we can learn from the work that they're doing. As well as we partnered with CIHI on some of the early efforts that they're underway as well to make sure that we're all kind of sharing knowledge that we may have. And then again, as I mentioned, we've spoken with health equity experts, including the Ontario Black Health Equity Group and the EGAP framework authors. And then, of course, the People's Panel, as I was discussed, the 54 members of the public who really came together to help advise us as well. So we worked with the Tamarack Institute and the Digital Justice Lab really to lead this panel and help us understand from a community and public perspective how race and ethnicity data should be used for health data research. So originally last spring, a recruitment call was issued and members of the public directly applied to be involved in the work. So as we mentioned, there's about 54 people that have replied to the call, and the ICES sought to hear directly from them to understand their values, how this data should be used and prioritized. They also reviewed some of the kind of initial working principles that we had pulled from the literature to understand if these aligned with their thinking and what they saw as a priority. And really over the course, it was about 5 focus groups that were conducted over the course of the spring. And through these focus groups, they kind of drafted some initial recommendations related to specific scenarios, both at a corporate level and a project level. And really all of this work was kind of summarized in a larger report and ultimately did inform kind of our 4 domains that shook out after this work. So this is just kind of a brief snapshot that essentially the People's Panel provided feedback into buckets, as I mentioned. There's kind of institutional level research processes, so things that were done by our corporate teams. And then there's kind of more project level research processes, so things that are actually done by an ICES scientists and projects teams. So again, these kind of recommendations surrounded both of these processes and really informed some of the key recommendations that we've also, recommendations and actions that we've actually included in our guidance document as well. And our plan right now is likely that once the internal guidance document is ready for release, we'd like to essentially share the People's Panel report at the same time. In addition to the People's Panel work, there's been a lot of behind the scenes work underway as well. So initially, it was the fall of 2020 when kind of some interim guidance was released. It was a memo to ICES faculty and staff just to understand kind of why this work was underway and some initial understanding of the goals and deliverables and some potential kind of limitations to our existing data and recommendations moving forward. We also have a page on our internal intranet, which provides some kind of initial readings and resources as they become available. As I mentioned, we had that memo to our faculty. So just a snapshot here. And again, kind of highlighting it was available on email and kind of our internal intranet page to get the communication out. So I'll just stop there for a minute, make sure everyone's paying attention. I wanted to do a really quick Zoom poll just to answer a quick question before we proceed. So what is considered the gold standard for determining individuals' race and or ethnicity in research? So if we could launch that poll, we'll just give it a few minutes. Oh, there it is. I see it. Give a few more seconds there. And then maybe if we can see the results. Oh, great. Yeah, so it looks like the majority said self-reported data. A couple people said administrative data, and a few people said there's no gold standard. So there's definitely nuances here. So self-reported data is kind of the gold standard. However, there's definitely nuances to that. Understanding that's not always potentially possible to use self-reported data, but also understanding, again, how is that data collected? Why was it collected? Who collected it? I think there's always kind of limitations to this and just understanding kind of the context to that. And not all self-reported data may potentially be the same. So really emphasizing and recognizing where it's coming from. And again, that's part of our work of the ongoing data assessment to understand kind of that source validity and limitations. So the last thing I'll mention in terms of some of the background work as well, and I think Susitha had kind of alluded to this also, was that there were algorithms at ICES that assigned race variables based on certain categories. And generally this is not recommended or often not best practice. So in particular, there was one algorithm that we did phase out the use of that assigned race categories based on country of birth and language from immigration data. So essentially this algorithm, again, there's essentially some concerns related to its use. And we just wanted to make sure, again, that we were being conscious and aware of how race was being assigned. So this was phased out. And another algorithm, we had kind of still in the process of developing an ongoing plan. So this second algorithm used race and ethnicity based on surnames. So surnames were used to kind of assign a race or ethnicity category. And we wanted to put in place more control around using this. So understanding when it's appropriate, when it's not, having a form that we can actually receive to review all projects, understand the use, and potentially also do they have a community engagement plan and the rationale for use of this data. So that's something that's still ongoing as we kind of work through the best way to promote this. So now that we've talked a little bit about kind of what work has gone into date to developing the document, we're now kind of thinking as we continue to draft and near a phase where we might start thinking about implementation. There's a few other elements that we've kind of had underway. So again, one quick Zoom poll here that will kind of leads into my next content and section that I'll be discussing. But basically, what is considered best practice and foundational to the respectful collection and appropriate use of race-based data in health research? So is it using data in a timely manner? Is it publishing the results in a peer-reviewed journal? Is it meaningfully engaging communities whose data are being used, or not to use the data at all? So if we could launch that Zoom poll, we'll give it a few more seconds. Great, maybe a little bit longer. I think we can close the poll and take a look at the results. Oh, great. So the majority, pretty much everyone said meaningfully engaging communities whose data are being used. And that's exactly right. And that's what a lot of kind of our initial efforts for capacity building have also been involved in, trying to make resources available and support scientists who may be doing this work. So kind of the initial groundwork in terms of our implementation, even before this document is ready, is this capacity building. And there's kind of three pillars I wanted to talk about. So one was our health equity in focus speaker series. We have health equity resources for the ICES community, and then we have resources to support community engagement. So the health equity in focus speaker series, I'll speak about on the next slide as well, but essentially we've had 5 speakers to date that have really covered a range of topics. And it's been an opportunity for staff and scientists to tune in kind of to a virtual meeting and just hear a little bit more about topics ranging from, how to engage with communities in an ICES project, from examples from our scientists, and then also kind of understanding more introductory concepts, even to understanding concepts of privilege and oppression. In terms of the health equity resources for ICES community, we also kind of have a monthly newsletter that comes out, and we include in that newsletter some readings. So anything new that's been published or relevant to health equity. Sometimes we include kind of first-person articles or commentaries. So anything that might be useful for our community, we post in the newsletter as well. And then resources to support community engagement. So actually as well, our office is doing a needs assessment survey right now to kind of understand what scientists and staff think would be useful in terms of resources to support community engagement. So we've kind of put forward potentially, would they like more workshops, webinars to be done, one-on-one consultations, or what resources in general do they think they would need? So that survey is underway, and then we'll use those results to help us understand what we should create and tailor to our group. This is just a brief snapshot of the speaker series. As I mentioned, this is just an example of 3 of the speakers we've had to date. And again, these are typically quite well attended, and it's just an opportunity to learn more about these topics and then also ask questions. So we try to do them monthly. We'll be kind of restarting that series this fall and continuing it going forward. So the last few things I wanted to talk about, and this is still very early stages, but a little bit of our implementation planning. So nothing's kind of set in stone as of yet, but we've been brainstorming a little bit about what this might look like. And really, I think it's important to note that our document will likely very much be a living document. It'll likely have ongoing changes and iterations as we continue to learn and continue the best way to structure some of these aspects going forward. So one of the things that we've already started to think about was what could potentially be short, intermediate, and long-term action that would really kind of guide a phased implementation of some key aspects under each of those 4 domains. So understanding that some things may take longer to kind of implement, for example, community governance, it's something that we want to make sure we get right. Again, development of an internal finalized document, still ongoing, something that we're drafting and making sure necessary folks have a chance to review. And again, also thinking about from kind of some of our staff, are there any barriers and facilitators to implementation that we also should be considering to understand how we can kind of help clarify this for our folks and understand what might be missing. So where are we at now and what are our next steps? So really, as I mentioned, we're reviewing, launching, and thinking about implementation down the road. So really still working on finalizing our draft and really thinking about kind of who needs to review and then ultimately begin release and implementation of the document internally as well as externally. Continue obviously to consult with community organizations. We really want to continue to host consultations to understand, how can we support communities in that kind of first domain of accessing and using ICES data, as well as obviously the community governance piece, and then even the accountability metrics going forward. Community governance, also we will be kind of exploring existing models that could be put into place, where are there opportunities for collaboration to avoid any kind of redundancy if there's a model already in place that's working, and really just understanding the best way forward for this piece. And then finally, really a strategy to broaden the science as well. So it's something that we've also been considering wanting to engage with a wider scientific community. So social scientists, health equity experts, understanding how we can continue to kind of expand our existing research in this area and co-design projects with ICES scientists. So that's something we're also working towards as well. So I'll stop there. Welcome to any questions you may have, but really appreciate you taking the time and listening today.
Thank you very much, Laura and Susitha. Okay, well, so the floor